Greetings, everyone. Welcome. Thank you for joining us so much today. This is our third Lunch and Learn series here at Community Campus Partnerships for Health. And today we'll be discussing culturally responsive dissemination. My name is Alan Wells, and I will be your facilitator today. Before we start, I would like to say that this session is accessible in different languages. So before we begin, our interpreters would like to provide instructions on selecting a language and channel. Take it away, please.
Thank you, Alan. This is Andrea. I am your Spanish interpreter today, along with my co-interpreter, Sandra. So I will provide a quick set of instructions, both in English and Spanish, so that everybody can hear us in English or in Spanish. For those of you who are in the session and would like American Sign Language interpretation, we have our two colleagues in the session as well, and you will be seeing them for the remainder of the session on the screen. Okay, so for English speakers, for hearing English speakers, please make sure that you select English as your language of choice. Just go ahead and click on that globe icon at the bottom of the screen that says interpretation, and then select English, and do not mute your original audio. This will enable you to hear everything that's coming from the main room in English. Okay, if you're joining through a smart device, simply tap on the screen to bring up the three-dot menu and do the same selection. Now we'll explain the same thing in Spanish. Okay, así que bienvenidos a todos. Yo soy Andrea. Estoy aquí como intérprete simultánea de español con mi cointérprete Sandra. Por favor, en este momento ya está activada la interpretación para que usted pueda hacer su selección simplemente desde su computadora. Haga clic en el globo terráqueo que dice interpretación en este icono en la parte inferior de su pantalla. Seleccione interpretación, después español. Si solamente quiere escuchar la voz del intérprete, puede silenciar el audio original. Si no, lo escuchará en el trasfondo a un volumen reducido. Si está uniéndose a través de una tableta o dispositivo inteligente, por favor, toque la pantalla ligeramente para ver el menú de 3 puntos. Después seleccione interpretación, después seleccione español. Si solamente desea escuchar la voz del intérprete, silencie el audio original y después listo o done para activar su selección. Si por alguna razón no nos puede escuchar, por favor, nos avisa en el chat y una de nosotras le avisará. Muy bien, muchas gracias. Ahora ya todo el mundo debe de estar en un canal de idiomas, así que ahora le pasaré la palabra de vuelta a Alan. Thank you, and back to you, Alan.
Thank you so much, Andrea. Everyone, please feel free to use the chat feature to share your questions and thoughts throughout the training and throughout. Let's move to the next slide. And now it is poll time. How would you describe your level of knowledge about community-engaged evaluation and dissemination? Please take the poll, and we'll just give you a moment to do that, and we will review. Okay, we're at 72% participation, 75% participation. Very good response rate. If you have a moment, just give us a gauge. And a few people are still streaming in. Okay, we have almost 80% of people have responded to the poll, so I'm going to end it and share the results. Now, I don't know if that registered. It looks like our knowledge levels range. We'll get from most people are fairly familiar. Some people are very familiar, and less people are not familiar with the concepts at all. Danae, can we see that?
Yeah, it's sharing.
Okay, next slide, please. Yes, so the majority of people are slightly familiar. So that gives us a good bearing about where the audience or learners are today. And here we go. So just a little bit about community campus partnerships for health. Starting with our mission. We are an agency or a company that promotes health equity and social justice through partnerships between communities and academic institutions. Next slide, please. In doing so, we have 5 strategic pillars that represent our work, our practice in the field. Over the last 25 years, we'll see that CCPH has been well known for leading, for taking the lead in community partnerships, bridging the work between academic researchers and community partners, convening meetings, community meetings for other people to share ideas, disseminating research, disseminating trainings and observation, partnering with agencies throughout the country from we are a membership organization, so we have many partnerships and agreements that we work with that we apply to different academic community partnerships throughout the country. And also a big part of our work is indeed training, like today with our Lunch and Learn series. Next slide, please. And people are still trickling in. So I'd like to take a moment for the icebreaker. Please share your name and pronouns first, and tell us where you're from and what community groups you work with, as you feel comfortable. We're just going to take a moment for people to weigh in for that.
Hi, I'm Christina, and I work with CRX, UVD, and SHARE, and we work with underserved populations in Rocky Mount.
Thank you, Christina. We can also everyone can put this in the chat too, or just chime in, please. Thank you, Christina. We have Emily Anderson from Northwestern University with immigrant populations in Chicago. Welcome, Emily. I used to live in Chicago in Rogers Park, up near you. Kelly from Milwaukee Medical College of Wisconsin, my alma mater. Thank you, Kelly. Emily Zimmerman, work with residents of urban and rural Comunidad Trabajas. Nice. So many people now. Yvonne, Jesse from Santa Cruz, K-12 to first and low-income students. Karen Morrison, researcher, UNC, welcome, ma'am. Cynthia Stewart, Loyola University, Chicago. Ann Berry, Duke Family Medicine, community-based orgs doing maternal health equity. Welcome, Ann Berry. Kaylee from University of Chicago, community liaison. Michigan State University, John McCoy White, see hers. African American birthing to improve maternal and infant health. Awesome. Leanna Adrang, Greensboro, North Carolina. From Montagnard, for low-income elders. Our panelists is from your agency, share stories. Michigan State University, supporting community engagement. Dr. Morrison, great to have you here today too. All right, everyone. Thank you so much for sharing. We're doing great with time. Let's move to the next slide, please. We're going to go over a few key terms that we have in our lesson today, also accompanied by our logic model from Engage for Equity from Dr. Wallerstein and all from the University of New Mexico. Community-based participatory research, research design and logic models, ways to put things together, dissemination and evaluation, and backwards design. So if we look at just the process at our beginning, we'll be discussing how we talk about culturally appropriate dissemination. This flow chart is a logic model that just shows the process that you go through to create a community engaged, a community-centered study. Oops. That's my timer. We're good on time. Pardon me for that. Next slide, please. So our learning outcomes as well are to explain the importance of dissemination in the community engaged research process. By dissemination, we will mean the distribution of research materials and ideas to the people that need it. We will talk about how to evaluate collaborative, culturally appropriate dissemination practices, the sharing of ideas in ways that are understandable, appropriately tailored to the community that you want to message. We will explore culturally responsive dissemination venues or ways to communicate, manners in which to communicate within and beyond academic traditional venues such as papers and presentations. Next slide, please. So community-based participatory research is defined by many people in different ways. Overall, it is an approach of collaborative research. It's designed to ensure and establish structures for participation by communities affected by the issue being studied, representatives of organizations and researchers in all aspects of the process. Next slide, please. We still have some people coming in, which is very good. If we look at CBPR, community-based participatory research and practice, and I know that we have a lot of practitioners here, and we hope to hear some examples from stories in the field. It recognizes the community as the unit of identity. It builds on assets within the community. It facilitates collaborative partnerships in all phases of research, including designing questions, conceptualizing research, and understandings from the very beginning of the process, all the way to the idea of generating knowledge and information and sharing it with the community members and the learners and the audience that needs to hear it. It integrates knowledge and action for mutual benefit of all partners. It promotes a co-learning and empowering process that attends to social inequalities. Community-based participatory research in its very nature has an emancipatory intent. That means it is involved in social justice. Dr. Wallerstein and our colleagues at University of New Mexico goes to far as to call it the new venue for civil rights. It involves a cyclical and iterative process, convening, reviewing, addressing. It addresses health from both positive and ecological perspectives. It disseminates or distributes findings and knowledge gained to all partners. This is from a research review, a systematic review of CBPR in practice. And I can give you this reference if you would like it. It will be in our notes. Next slide, please. If you look at the idea of traditional scientific research or traditional empirical research and compare it with community-based research in health studies, it is strikingly different from objective empirical design in many ways. For example, traditional health studies, academic experts defined focus of the research and defined its aims. In the CBPR approach, community members and academicians define the focus of research and define the research aims. Second, from left to right, the research aims in empirical traditional research aims to create original knowledge with systematic objective methods. In CBPR health studies, research aims to make change with collective approach to problem solving. For example, in the arc of CBPR, we have many studies that simply document health disparities, inequities. However, a CBPR approach would move towards, rather than documenting disparities, we would take the stance that disparities data simply don't answer any questions, they rather raise them. What needs to be done? How do we address problems? And that's the pivot that involves a different approach in collaboration. In traditional research, experts interpret findings and disseminate data to an academic community. In CBPR studies, the impacted community members and researchers collaboratively interpret findings and disseminate data. And that's what our session today is about, actually, in the research design and dissemination of the ideas generated together. And lastly, for today's discussion, we would say that traditional research aims to describe and document health disparities, as I've touched upon before. In CBPR, the research aims to solve problems that cause health disparities. We are more solution-driven. You go beyond documentation to problems in the field. Instead of documenting maternal disparities and health outcomes, maternal mortality data, you get into the field, you work with the community and address it. And I'm sure this is just rudimentary background for many of our audience members today and many of our learners today. So for review. Now let's move on to the next slide, please. Engaging communities, as one thing we often think is useful, is a conceptual model or a logic model that follows a process from one step to the other of how to build community-based programs. Begin with context, your social and structural context, your health issue of importance, the assets in the community, the readiness of the community, the collaboration and trust, the types of partnerships you're working with. Then you enter into the partnership processes, which is very, very important. You look at the partnership structures. What are the community advisory boards? What agencies are you working with? What is the mix? What is the leadership? And what are the relationships and characteristics within that that will allow the group to collaborate successfully together? Moving on to intervention and research, we look at process and outputs. And that's what we're going to talk about today. How can we integrate community knowledge to create culturally appropriate centered interventions? What is the empowering process making the partnership work? What can drive it to be successful? How is the community involved in the research science? And how is the community involved in the research design? I was lucky enough to have a nice discussion with our panelist, Andrew Young, before about this, and we're looking forward to hearing examples of how people have met in the field and designed and decided how to disseminate, how to distribute original knowledge from studies together. In the outcomes, we look at intermediate and long-term. You may impact a policy environment. You may look at something like sustaining the partnership over time, making mentoring, making people feel empowered by the research partnership. I know that in many collaborations I've been in the past, I'll see people that now have PhDs and master's degrees who are community members, who were engaged in research and became administrators and researchers themselves. I see many people that go to Washington who were community advocates and now we're advisors in DC. You have to mentor through this process and support the community partners, long-term looking towards our ultimate goals of building health equity, achieving greater social justice, and looking for community transformation. Next slide, please. So if we look at research design and community practice, what we're going to talk about today, I would say plan dissemination from the onset, from the very beginning of your study. Think about questions like this. What does the community want to see? And how will it measure the success of the programs? What information should we collect? How will we use the information we collect to make change? And how do we decide how to measure success collectively? Many times in academic studies, this is an afterthought, unfortunately. And I think our panel today will talk about ways that they encourage and engage the community all the way from agreeing to the research to actually producing it and deciding how it will make an impact. It's very important for an effective program. Next slide, please. Okay, for the chat form, please put into the chat in the message, how have you facilitated community members to make decisions about a research plan? Just shout it out. Come off mic if you'd like, or put it in the chat. We just have just a few snapshot examples of your work. And I'm going to mute myself and listen for just a few minutes while we do that. Thank you. Focus groups and community advisory board, very good. Listening sessions. Site visits, group gatherings, strategic planning meetings where we facilitate discussions about the research plan. Thank you, Kaylee. Collaborative research teams, stakeholder panel discussions from Emily. So I see that everyone is giving a good example of how to bridge traditional empirical science to communities by simply giving people venues to discuss. Susan, invitations to community members, partners to submit research proposals themselves would help if they wish. Have community members as a part of your research staff, very important, very important. New schools and universities that want to establish community programs see it as very important to start hiring from the community from beginning. Having communities, and that's from Kaylee Gordon, who's helped us a lot with some comments. All right. So in the effort to stay on time, and these are very, very helpful, I'd like to move on to the next slide, please, and go into our panel. And interpreters, I'm going to introduce our panelists now, starting from left to right with Andrew Young. Andrew, and I'm reading in the first person for Andrew because he is that kind of guy. I have lived in North Carolina for 39 years. My degrees are from Rhode Island School of Design, go RISD, where I did a full year of study in Rome and is at the Yale School of Art. As a studio artist, I taught in California at Humboldt State University and College of the Redlands, and in North Carolina at Alamance Community College and Guilford College. I spent about 10 years in the emerging fields of interactive media and game design, which profoundly changed my understanding of economics, technology, media, and systems, and overall learning. In the final part of my career, I have taught English as a second language, worked closely with the Montagnard refugee community, and through the Bonner Carter Community Service and learning advised from a wide range of backgrounds, including low-income, international minority, and refugee origin. I am a founding member of a research network of about a dozen academicians and researchers who work closely with Southeast Asian and other refugee communities in our area. I am a grant writer and a trainer as Montagnard Dega Association, and one of the oldest refugee community-based organizations in the state of North Carolina, and also served as a non-voting member of the Community Advisory Committee. This committee reviews research and scholarly proposals prior to approval by the community. And thank you for being here, Andrew, and thank you for that bio. Lennon Caro is the lead community research with Camino Research Institute. He is spearheading studies on the Latino community of North Carolina. He currently teaches anthropology at UNC Charlotte. In 2017, he received his master's in cultural anthropology from UNC Charlotte, focusing his thesis work on the evangelistic practices of Christian campus ministries. Lennon has 8 years of experience in conducting, presenting, and publishing research on diverse topics, including volunteer tourism, Christian subjectivity, nurse burnout, and stress coping processes among Latino immigrants. His current research focuses on investigating the impact of the social determinants of health on Latino immigrants in North Carolina. All right, panelists. Let's get started. And we prepared some questions. And the first one, let's just throw this out here. Could you please share some lessons from your practice in the field to create dissemination plans with your community? What are some ways in which you were able to facilitate a research plan and data plan that was inclusive and community-centered?
Hey, so I'll try to tackle that, and given the time constraints, I will try to speak quickly, but not too quickly. So I want to maybe also make a couple of remarks about your introductions. So a few years back, I had the experience of hearing at a conference the vice president of a big health insurer who will not be named, who said, "Yeah, we know all about social determinants of health." And before the whole audience, he said, "But we really don't know how to do it." And that was a big eye opener. How I think this gets to the point about how to address the problems. I would say that the recipe for disaster is top-down stuff, discomfort with being uncomfortable, time constraints, agenda-bound projects. Recipes for success are if you're comfortable making group decisions, taking risks, having flexible schedules and listening to others, and changing plans. So working with the refugee and immigrant communities in this area, the standing joke is that this person or that group isn't here because we're on Montagnard time. Montagnard time looks a lot like Bhutanese time, which also looks a lot like Congolese time, which means the communities are setting the agenda. And I think that's pretty much, as your extensive slideshow demonstrated, that's what CBPR is all about. I'm just going to try to hit the high points, but I would say that I'll just repeat this again and again and again. The relationship building is key. And I think in public health people, they repeat that 3 times so that it sinks in. But if you have weak relationships, then pretty much everything else, to be very frank, would just go downhill. In working with the refugee communities, to give example, Montagnard community and many of the Southeast Asian and North Carolina have been around here for 35 years. So American side has had 35 years to build the relationships. We can talk about how well those relationships have worked out. The Bhutanese community, DR Congo, has been here roughly 12-ish years. Afghan communities come here about a year ago. So if we want to get to know the Afghan community, I'd say let's get started. The relationship building takes years. Ultimately, we're talking about trust building. And then the last point I would just say is the evaluation and dissemination means grow out of your relationship with the community. If you have a strong relationship and you know your community, then the evaluation and dissemination means is pretty obvious. I'll leave it at that. I'll leave it at that, and I'm very anxious to hear my fellow panelist Lennon speak. So thanks so much.
Thank you, Andrew. Lennon, please.
Yeah, I kind of want to share that when it comes to CVPR, I've only been practicing it for 2.5 years now since being in this position at the nonprofit. I originally envisioned myself to be an academic anthropologist and just go on to get my doctorate, but life happens and I found this community-based job and started doing more community-engaged research. So it's a new world for me. We structured our strength and needs assessment that we're doing across North Carolina by making a community advisory board. And they were basically, people that the organization I'm part of, Camino, had kind of relationships for years. So I just want to echo with Andrew, like that was absolutely key. What also helped was that I've been in part of the Charlotte Latino community for, since 2006. I kind of grew up here. So it was not too hard to convince other people to come on board and, trust me and work with me. So there was a bit of a shortcut that we took as an organization, right? We had people who were already connected to build this community advisory board. But when it comes to dissemination, one thing that stood out to me is that, even when it comes to the Latino immigrant community, it's not a monolith in and of itself. There's different classes of people within this community. And I noticed that some of them were more influent than others. And I really had to make sure I was talking not only to the folks that were part of nonprofits or nonprofit leaders, but try to make sure that we're also talking to people of the working class community within the Latino immigrant community. And we noticed that when it comes to dissemination, some of the nonprofit leaders wanted more formal reports so that of the study that we're doing so that they can reference it in their grant writing and things like that. Meanwhile, the more working class folks wanted, a bit more engaging stuff like more visual infographics. And some of them even suggested making a video, which we actually did do as well. So that's what stood out to me, that you gotta keep in considerations that there are different classes of people within a minority community. And if you wanted to cater to all of them, you have to consider that you're going to be using multiple mediums to communicate dissemination, not only through paper or visual, but I believe you're going to have to do the extra work and do more.
Yeah, Andrew, that's very true. There's mixed media. You have to have multiple methods for dissemination and be creative along with the formal reports that keeps the lights on, right? Keeps your patient bills. Andrew, any comments?
Yeah, I mean, I definitely agree with everything Lennon is saying here. I'm going to jump to some pretty broad statements. When it comes to the dissemination stuff, just give the details. I mean, as I said, if the researcher, if the funders know the community well, then the kinds of evaluation and dissemination, as I mentioned before, should be obvious because you know that community well enough. The example that I can give is working with the Montagnard community. There's over 5 languages spoken in this community. So, okay, if you want to take this very linear process of we did the research, we have these findings and stuff, and now let's chugging out videos or printed matter or whatever the case may be in 5 different languages. You're going to blow your budget. You will blow your budget. In fact, that's one of the reasons why this particular community has been so underserved, because as soon as you look at the quote unquote problems that this community presents when it comes to the classic way of dissemination, you're going to go like, well, no, we can do other stuff. So I just want to say, in essence, it's a power thing. It is a power thing. And during COVID, COVID revealed the system weaknesses and the real failures of actors. In other words, prior to COVID, too many languages to interpret, too difficult. Maybe it's too many class groups, too many different leaders within this community, whatever the case may be, we're not going to do it. During COVID, for many of our communities, it demonstrated what communities could do when they were properly supported and funded. That means money stuff. So when we get back to this thing of looking at dissemination and everything, look at the budget. look at how the budget is being conceived, because if the budget basically comes down to the case of, oh, I don't know, interpretation or translation, and you're only putting in pennies, you're not, you can call that dissemination. It's not going to have much of an effect. So I think for those, if you know the community well, if you understand how it works and so on, then the means by which you would communicate afterwards in delivering data, et cetera, would be pretty obvious at that point, and appropriate to that community's knowledge base, their understanding, and so on and so on.
Yes, and just quickly, as we've closed out your comments and moved to the breakout sessions, do you have any pointers for like how to help people with research design so that they can protect the community messaging, so it doesn't get lost in the shuffle of all the admin of all of the? For example, do you find it important to really like put that up front in the budget and conceptualize that up front?
Well, yes. I mean, basically my answer is yes, because if you will, the way in which we show love or respect for, and if we want to elevate folks to community partners, it's going to come through the budget. It's because the power differences in working with different funders, with universities, and so on. The power difference is obvious, and so yeah, it starts with money, and yeah, it doesn't end with money. What we hope is that over a period of time, a very lengthy period of time, there are strong relationships and trust that are built.
Lennon, in closing this section, Lennon, do you have any final comments that you have? I really appreciate your looking at the mixed media messaging and the different kinds of people that you have to respond to. Pardon me. And just final comments.
Oh, no, yeah, just to echo with Andrew, yeah, you absolutely have to have that budget, planned out ahead, because it can eat up a lot of resources, because materials cost money, the time to design things, it's a lot of time. I work more than my 40-hour work schedule. I did a lot of, kind of overnight things just to make sure I get this infographic or get the the data points that my community advisory board wanted for, preliminary stuff. I didn't get compensated for that, but, to me, what was important is that my CAB felt like they were equal partners in this process. So it was like, yes, I'll do it for you. Let me serve you. Let me help you get this data point. You help me gather it. Now let me give it back to you.
Thank you. Lennon.
If I could just add one more thing about
Yes,
that.
sir, absolutely.
Dissemination process and so on, and in some sense the measures of success, as we may look and evaluate, and oftentimes the nature of a project is such that we are measuring and evaluating within a certain time frame, and oftentimes, unless we know the communities well, we're not looking at the, if you want to call it, second and third order effects. Things that happen 1 to 5 years later on, when researchers and everybody else have gone home and done other stuff. But I would say that the ability of the community group to leverage, whatever the data, the findings, whatever you want to call it, to leverage the relationship is the single measure of success, in my view.
Awesome. And thank you so much, panelists. I know the time is so short. I just want to take a moment to read a comment from David Pohl, because I think it's a good wrap up. It says, elevating partnerships has required me to imagine navigating the academic system from the community partner lens and maintain that empathy and voice as I navigate admin on the academic side. Also, intentionally and consistently advocating that these are community academic partnerships, not just an academic community. Thank you, David. We are going to take a moment now. We have changed it up a little bit today. So we had the panelists speak first and sort of put some ideas out there. Then we're going to move into working breakout groups. The agenda for that is a very simple one. We want you to brainstorm, even list methods to apply a CBPR approach to dissemination in your community. And we will check back in and do an evaluation and wrap up after this. Thank you. Okay, next slide, please. We encourage everyone to check out our other training offerings. Thank you so much for your time today. We have a saying here at CCPH that progress happens at the speed of trust. So our next trainings are going to be on community advisory boards. Next slide, please. If you would like to support the organization, we suggest that you check out our website. And I'm going to move on to a short evaluation that we would encourage you to fill out. We're going to play some nice music for you to relax and do that in our closing few minutes. So let's move to the next slide with evaluation. And then let's move to the evaluation slide. Here we go. Yeah, just take a few minutes to do that, and we certainly do appreciate it. And we will close right directly after. Thank you.
In a minute, what's going on here? Okay, what's going on here?
We'd just like to thank everyone for your time for the evaluation. Thank you for sharing the space with us today. We appreciate your engagement. If you want to remain involved or engaged with our trainings, please do so. Our next training is on community advisory boards. We are really aiming to build practice relationships from the field, share your experiences with us, and we can all learn together and convene even virtually. Here's our Twitter account, our Facebook account, and our LinkedIn account. And thank you all so much for being here today. We're going to end promptly at 1 o'clock. Thank you and have a wonderful afternoon.